Speaking of sports medicine, let's bring him in. My good friend, Dr. Joe Congini. He's been part of this morning show for over 30 years. Good morning, Joe.
Hey, Ray. How you doing?
I'm doing great, my friend. How are you?
Good. Are you ready for a challenging sports medicine issue?
I always am when I bring you onto the show, my friend.
Early in the morning, a challenge for your audience because you guys are all so good. When I get around town, people want to learn a little deeper, and this is a little bit of a. We're going to go a little bit deeper today with this one, and I wanted to talk because so many people asked me a couple of weeks ago about the DeJuan Jones injury. You probably noticed, and people that follow the team and sports medicine some too, they didn't announce right away what the injury was. Knee injury, that he was out for the year, he was having surgery, it's even career-threatening, but everybody was asking, was it an ACL? I remember at the first press conference and others, ACLs we hear about all the time. We hear about people with significant MCLs and even torn cartilage, meniscus, where they're out for the year. But his wasn't any of those. When they finally, about a week and a half, I think, before we finally found out what it was. And my expectation, I have to admit, from lots of years of being on the sideline, even from the very beginning as I saw this injury, was that it was the fairly unusual injury that's a little bit more complex. It's called a posterior lateral corner injury. And a posterior lateral corner injury, in looking up some things about it, I've seen several in my career, it's as high as 8 to 12% of knee injuries. That surprised me. I looked at 2 or 3 different articles. 8 to 12 is a little bit higher than I thought it would be. But the posterior lateral corner is a complex anatomic group of structures that are in the back and the outside of the knee. And so when you get hit in a certain way, they become at risk, and if they tear significantly, they need surgery. They don't always bounce back with, great, with ACLs, you know how well we do and how quickly people come back.
Yeah. Posterior
lateral corner injury, some athletes don't get back from, and that's been some of the issues about people concerned about DeJuan Jones. But the damages to the outside and behind the knee, it most commonly in football, but skiers get it a lot too when they lose control of the skis. I've seen it in soccer players in a career as long as mine has been, but it's primarily football. And when you examine them, and I could almost see it through the TV, when you look at that knee, the knee is really loose in that back corner, and there's no stability there. And when it's totally loose, you're really concerned it's a significant tear. So just 3 points that I want for take-home points today, Ray. Number one, this occurs especially in football, and the mechanism is a chop block. And it is when the knee gets hyperextended. And so his was absolutely classic, if you remember a few weeks ago, as he was going out to block, somebody hit him low, below the knee, a chop block that's called, hyperextends the knee. There is increase in the looseness of the knee. It has a very high injury rate. It's one thing that we have talked even in sports medicine about through the years, certainly in going back to high school days. Perhaps even we ought to have a stronger penalty, a penalty on the field, or even removing a player from play if we, with a bad chop block, because it may be a little bit like targeting with concussion. It has such a high injury rate when somebody gets chopped like that, and so they tear these structures in the back corner of the knee. Number two is, a lot of people there's people that really watch very closely. They said, hey, he had a brace on. Why didn't that prevent him from having this injury? All those linemen particularly wear bracing, as you know. Sometimes we see it in the skill players if they've had an injury before. And so I want to mention briefly about bracing. Bracing does a great job to prevent MCLs, the medial collateral ligament, the one on the inside of the knee. Bracing does maybe plus minus a certain kind of brace called a derotational brace to prevent ACLs, but bracing doesn't prevent this injury much at all. And so when you get hit and chopped in the front of the knee, it puts the pressure on that back corner of the knee, and it tears very frequently with this particular injury, chop block. And number three, it can be a part in its really worst form of that wipeout injury or terrible triad that we talked about, Nick Chubb. That's probably how it gets up to as high as 8 to 12% of knee injuries. So it sometimes is, with this complex anatomy and multiple structures tearing, it can actually be a part of the Nick Chubb injury in Cleveland lore. Of course, it hurt us so much as we love Nick Chubb as a player and see him battle through two of them in a career. So the posterior lateral corner injury is a little-known injury in the back of the knee, and I wanted to go down the road a little bit more complex because as I hear around town, people say, gosh, Ray Horner knows everything. And I said, I know that, but I just wanted to throw out a more complex injury today with posterior lateral corner is what it appears that DeJuan Jones had. He had surgery on the 25th, I think, or something like that, and he'll be recovering, but it is one that sometimes athletes have trouble recovering fully from. And one final thing, I think there's a possibility that there should be an increased penalty for this chop block hitting somebody below the knee like this.
Joe, is that why we see a lot of the offensive linemen wearing those extra braces because they're in the middle of all that mess and those blocks are hitting low?
Exactly. No doubt about why the offensive linemen, even in high school. One good point about bracing also, though, you have to have a well-fitted brace. So a lot of people just go in, they don't have the help of one of their trainers or a bracing person, and they put on a brace. You could be at more risk if it doesn't fit you well. But a well-fitted brace is great for MCLs and ACLs, which are the majority of knee injuries. But for this particular injury, it just doesn't protect very well, Ray. And so you're right about that. That's why, because they're in the middle, they could be in a scrum, two people blocking and somebody rolling up their knee, they call it in sports, in football terms. Somebody rolls up their knee and they tear a ligament. And that's exactly why when those things occur. Of course, the skilled people don't like to wear them unless they've had a significant injury because they're bulkier, slow you down a little bit. But almost all the interior linemen wear them.
Joe, you heard the breaking news this hour, and you're a sports fan as well as a doc. Browns making a change at the starting quarterback position. Dillon Gabriel is going to get the start in London against the Vikings.
Very, very interesting. I think we knew it was coming.
Yeah.
I think that, again, sports medicine hat, of course, I watch all these games from a sports medicine standpoint, but as a huge fan for my entire life, we do have a really exciting rookie class, Ray. It's really fun to watch a few of these rookies play, and it actually has given us some hope for the future no matter what happens this year. And boy, would it be nice if one of these quarterbacks, and particularly the first crack at a Dillon Gabriel, turned out to be a very good player as well. So we'll get our first chance to look at him and see if there's some potential and hope there to add him to what is already a great rookie class.
And on the other side, too, who better to learn from than a true pro in Joe Flacco, who has been a true pro wherever he has gone. He serves as a good mentor. Maybe not some of these other veterans do, but Flacco is the perfect guy for Dillon Gabriel to learn from. So we'll see what happens on Sunday.
Yeah. I just say thank you to Joe Flacco. What a pro in every way. We love what he's done. In the quarterback room, he'll be great for both of the rookies or anyone else that would come in. And thanks for stepping in. This was a no-win situation. We had all the tough games front-loaded, and they kind of put him out there almost, you think, Ray, as a sacrificial lamb while the rookies were learning under him.
Yeah, a little bit like that. I think we all knew this was going to come at some point in the season. And here you go with this trip to London. Thanks, my friend. Always appreciate the time. Good insight, Joe. We'll do it again next week.
Have a great week, Ray. Thanks.
You got it. Dr. Joe Congini, part of this morning show for over 30 years.